This is a brief training for the care of Foley catheters for our patients. We need to remember to assess the need for urinary catheters on a daily basis. If a patient does have an indwelling urinary catheter, the order must be rewritten every 48 hours. When we are assessing the need for the urinary catheter, we can simply use the acronym Houdini, and this will determine whether or not the patient has qualifying indications for keeping the indwelling catheter in place. You can assess to see if the patient has gross hematuria, if they have a medical diagnosis of urinary obstruction, do they have a history of urologic surgery, do they have a decubitus ulcer or an open wound and they are incontinent, or do they have a neurogenic bladder? Do they need the catheter because they need eyes and O's to correctly manage them and they must be on strict eyes and O's? Do they have it because they're no code or they're getting comfort care or hospice care? Or are they immobile due to physical strains? If they have any of these qualifying indications, then it is appropriate to keep the indwelling catheter. If there are no qualifying indications, then the catheter should be removed. And it is important to note that a physician order is not required to move the urinary catheter. If the catheter is removed, there are some things that we need to make sure that we do to provide appropriate care. We need to assess that the patient has voided within 6 hours after removal of the catheter. If the patient has not voided, then the nurse is going to assess urinary retention using a bladder scanner. If there is a volume greater than 300 milliliters seen by using the bladder scanner, then the patient needs to have a straight cath placed. If there is less than 150 milliliters seen on the bladder scanner, then that needs to be reported to the provider. If the patient does not void within 6 hours of the straight cath, then that also needs to be notified to the provider. When we're performing catheter care, we need to make sure that our patient has a securement device in place. We should make sure that the catheter is cleaned twice daily with soap and water. And if the patient is not allergic to chlorhexidine, the catheter tubing should be cleaned daily with chlorhexidine wipes. And at this time, we will play a brief video for catheter care.
Raise bed to appropriate working height. Facing the patient, stand on the left side of the bed if right-handed, and on the right side if left-handed. If side rails are being used, lower the side rail on the working side of the bed and raise the side rail on the opposite side. Inspect urine in the collection chamber for color, clarity, and quantity. Ensure that there are no kinks or dependent loops in the catheter drainage system. Position the patient. Female, dorsal recumbent position. Male, supine position or sitting position with thighs slightly abducted. Cover the patient's upper torso with a blanket and the lower extremities with a bed sheet, exposing only the perineal area. Place waterproof pad under the patient. Remove gloves, perform hand hygiene, and don gloves. Remove catheter anchor device and free tubing. Expose urethral meatus with non-dominant hand. Female, gently retract labia to expose urethral meatus and catheter insertion site fully. Male, retract foreskin if patient is not circumcised. Hold the penis at the shaft just below the glands. Assess the urethral meatus and surrounding tissues for inflammation, incrustations, swelling, or discharge, and ask the patient whether burning or discomfort is present. Provide routine perineal care with soap and water. Application of topical antimicrobial agents is not recommended. Stabilize the catheter using the non-dominant hand. Use a clean washcloth or prepackaged approved wipe to clean the perineal area and the portion of the catheter in contact with the perineum or meatus. Cleanse away from the meatus to remove any secretions or incrustation. Remove all traces of soap and pat dry with a clean towel. For males, reduce or reposition the foreskin after care. Replace as necessary the securement device that anchors the catheter to the patient's leg. Avoid pulling on or placing tension on the catheter. Secure the drainage bag and tubing below the level of the bladder.